Moving into lower body work, we'll need our blue Theraband. We'll hold it like you hold a jump rope, wrapping it around the knuckles on both hands with the thumbs on the outside. Coming to lie on our back with our feet on the foam roller, bringing it in as close as we can to our butt, externally rotating the legs from the hip sockets so they're in a wide second. Subtle external rotation, and make sure it's from the hips, not from the knees or feet. We don't want to bother the knee joints. So from here, we'll be doing cactus arms. We'll do one at a time. We'll do this slide like a lat pull down or like chicken wings on the Pilates reformer, keeping the arms sliding down as we lower our body. So we'll lift up, 2, 3, 4 into our bridge, wide leg bridge, and as we lower, we'll pull down, 2, 3, 4. Lifting up, 2, 3, 4, lower down, 2, 3, 4. Lifting up, 2, 3, 4, lower down, 2, 3, 4. Keep that going. Lift, 2, 3, 4, and lower, 2, 3, 4, and lift, 2, 3, 4, and lower, 2. So as you're lowering, you're pulling that arm down into that chicken wing position, and it slides back to cactus as you send the pelvis back up. Give me one more. And let's switch the working arm. So if the roller is getting far away from you, you need to push down and out like you're trying to split it in half with your legs. Not only pushing down, but also pulling out with the feet or with the legs, with the glutes. Okay, here we go. Take it up, 2, 3, 4. And as you slide that arm down, you lower and you brace your abs. 2, 3, 4. Inhale, lift. 2, 3, 4. Exhale, lower. 2, 3, 4. Inhale, lift. 2, 3, 4. Exhale, lower. 2, 3, 4. Inhale, lift. 2, 3, 4. Exhale, lower. 2, 3, 4. One more. Lifting. 2, 3, 4. And lowering. 2, 3, 4. Set that blue Theraband to the side. Bring your green loop band back around your outer thighs. And if you had sway back or flat back prior to pregnancy, you can also add the anti-burst ball between your inner thighs. This time, you'll need your black Theraband, and it'll be under your bum. And you'll wrap it around the knuckles with the thumbs on the outside of both hands, but you're going to push your hands into the floor and pull out on the band at the top of your parallel regular bridge. The legs, the roller is close to the butt, but if it aggravates the knees, you may have gone a little too close. But make sure you're not feeling knee pain because your abs are disengaging. So you got to pull the core in. That's one of the most important parts of working on a stability device, to activate certain muscles that are underactive. So here we go. We're going to inhale, lift. And at the top, we're wrapping our toes around the roller. We're pulling out on that band. We're going to breathe. Deep inhale and exhale. Inhale 4. Exhale 4. Inhale 5. Exhale 5. Peeling down upper back, mid back, and tailbone, slackening in on that band. Making sure the roller isn't too far away and it's not all hamstrings. We want to feel the butt muscles too. Bring the roller in if it's gotten a little far away. Wrap the toes around it. Inhale, tuck the pelvis and send the hips up. Hold them up. Brace your abs. Exhale the air out. Pull out on that black band. Pull out. Good. Inhale and exhale. Inhale 4. Exhale 4. Inhale 5. Exhale 5. Articulating the spine, lowering upper back, mid back to tailbone. Let's do one more. Tuck the pelvis. Inhale, send the hips up, pulling out on the band. Exhale the air out. Inhale 2. Exhale 2. Inhale 3. Exhale 3. Inhale 4. Exhale 4. Inhale 5. Exhale 5. And peeling down slowly. From here, we'll drape our legs over the roller with it under our knees. You can keep that band on if it's on your thighs. and set the ball to the side. Little footwork. If you have lordosis or kyphotic lordotic, we'll be doing E version. Inhale, prepare, no movement. Exhale, circle the feet out. 2, away from the body. Inhale, pause, no movement. Exhale, circle the feet out. 2. Keep going with that. Sway back posture. Inhale, prepare. Exhale, circle the feet in. 2, 3, 4. Inhale, pause. Exhale, circle the feet in. 2. Keep going with that. Flat back posture. Inhale, prepare. Exhale, flex your feet. 2, 3, 4. Inhale, relax the feet. Exhale, flex the feet. 2, 3, 4. Now, if you're not sure what you had prior to pregnancy, if you were flat back, sway back, or lordotic, then I would advise you to go with whatever feels the most uncomfortable, because that's probably where you need the most work. Keep going. We've got another 30 seconds here to work into those feet. This is great for proprioception, for waking up either the lateral or medial intrinsic muscles of the feet, combating plantar flexion in the ankles for our flat back posture, and alleviating shin splints. We've got another 10 seconds here. Remember to pause on the inhale and move on your exhale. Try to kegel on your exhale as well with your belly in towards your spine. All right, let's let that go. If your green loop band is not on, now's the time to put it back around your thighs. We're going to need our black Theraband again this time. It'll be above our thighs, and we'll wrap around our knuckles with the thumbs on the outside and push the palms into the floor, stretching our legs out long with the heels on the roller, soft bend in the knees, legs parallel. We'll inhale, prepare, lifting up into that glute bridge as we pull the roller in, pulling the heels into the bum, and we'll take them out and in 5 times. 4, 3, 2, 1, lowering down upper back, mid back to tailbone, pausing at the bottom, inhale, lifting back up, exhale, 5, 4, 3, 2, 1, lowering slowly, inhale, pause, lifting up, exhale, 5, 4, 3, 2, 1, peeling down upper back, mid back to tailbone, and give me one more set. Inhale, taking it up, pushing the palms down into the floor, and we go out and in for 5 and 4, 3, 2, and 1. From here, let's come to, we'll take this black band that we have, and we're going to lie on our back. Option, if you know your hamstrings are pretty tight, to place the anti-burst ball under your head. You'll definitely need to take the green loop band off, so slide that off. And as I said, anti-burst ball under your head if your hamstrings are super tight. Mine aren't, so I'm not going to use it because it's not necessary for me, but use it if you need to. Take your dominant leg or tighter leg up with the black Theraband now around the arch of the foot, and just stretch out that hamstring here. Fight for a neutral pelvis. So notice if you're rounding or arching your back tremendously, see if you can find somewhere between that arch and rounding position with your belly firm, lifting in and up on those muscles that stop your stream of pee, plugging your shoulders down. It's really important that you maintain a neutral pelvis for your back safety. So belly firm, lift up on the muscles that stop your stream of pee. Let's open up those hamstrings after all those curls, all those bridges. Hang in there, breathe. One more breath here. And let's switch the leg. Nice release for the hamstrings. Flexing the foot, neutralizing the pelvis, breathing into that. Inhaling, bracing your abs and exhaling. Inhaling, low belly firm, exhaling. And one more breath, inhale. And exhale. Let's take a figure 4, going back to the first side. Ankle crosses over the knee. If you have flat back, flex your toes. Everybody else point the toes. And the leg that's crossed over, you'll use that same elbow on the inner thigh to open that thigh. And you'll use the hands to pull the bottom leg towards you. Watch out for rounding in the low back. Tip your tailbone down. Try and find some extension in your lower pelvic floor. in your pelvis, excuse me. Lower pelvic floor muscles should be lifting up. Stop that stream of pee. Kegel, Kegel. Slowly release that. Switch sides. Remember to point your toes. Every posture except flat back, you'll flex the toes. Hands thread through, grabbing the hamstring. Remember that ball can be under the head if you can't reach the legs easily. Don't want to strain the neck in the process. Keep reinforcing that proper pelvic position. Breathing here. 2 more inhales and exhales. Great job.